నమస్తే సార్, నా పేరు లక్ష్మమ్మ. కొత్తపేటకి వెళ్ళి వచ్చిన. ఇక నాకు జ్వరం వస్తుండే, అది మా బిడ్డని తోలుకొని వస్తే ఇక్కడ చూపించింది యశోదల. చూపిస్తే సోమవారం వచ్చినాము. మంగళవారమే ఆపరేషన్ అమ్మ, నీకు ఇంత ఉన్నది, ఎట్లా ఉంచుకున్నావు, ఇంతగానము డేంజర్ ఉన్నది అని చెప్పిండు. సోమవారం నాడు వచ్చి జాయిన్ అయినా. మంగళవారం ఆపరేషన్ అయింది. షుగరు బీపీ ఏం లేదు, అన్నీ మంచిగా ఉండే పట్టుకుని ఇట్లా అయిన బిడ్డ. ఇప్పుడైతే మంచిగానే ఉన్న బిడ్డ. డాక్టర్లు కూడా మంచిగా చూసిర్రు నన్ను, నర్సులు కూడా మంచిగా చూసిర్రు. అప్పుడప్పుడు వచ్చి వీళ్ళు చూసిర్రు, వాళ్ళు చూసిర్రు, అందరు చూసిర్రు బిడ్డ. మంచిగా చూసిర్రు నన్ను, అమ్మలేక చూసుకుర్రు వాళ్ళు. డాక్టర్లు అయితే అమ్మలేక చూసుకుర్రు నన్ను. ఆయమ్మలు కూడా మంచిగా చూసుకుర్రు, పట్టుకపోయిర్రు, తోలుకపోయిర్రు. ఎట్లుంది అమ్మ అని కూడా వచ్చి అరుచుకోరు కూడా బిడ్డ. మంచిగా చూసారు. జగన్మోహన్ రెడ్డి డాక్టర్ కూడా మంచిగా చూసిండు. సురేందర్ రెడ్డి కూడా వచ్చిపోయిండు, పొద్దుగాల మంచిగా చూసిండు. తొలుత చూపించుకున్న నాడే ఆయన చూసిండు. నాకు కొడుకు లేక నువ్వు బిడ్డ, నాకు బిడ్డ లేవు, కొడుకులు లేరని చెప్పిన. ఇక వచ్చి 2 రోజుల సంది కూడా అరుచుకొని మంచిగా పోయాడు. ఆయన పోయిండు, ఈయన పోయిండు. ఇప్పుడు వచ్చిన ఆయన కూడా పాపం, ఆయన కూడా మంచిగా మస్తు టెన్షన్ తీసుకుండు. ఆయన అయితే ఎట్లయితుందో ఏమో అని. అందరికీ ధన్యవాదాలు. నాకు పానం మంచిగా అయ్యింది. డాక్టర్లతోటి, నర్సులతోటి అందరు మంచిగా చూసుకురు బిడ్డ నన్ను అయితే.
హలో, దిస్ ఇస్ డాక్టర్ T. Surender Reddy, senior laparoscopic and robotic surgeon. I am working in this hospital since past 21 years as a consultant general laparoscopic and robotic surgeon. Today I want to share my experience of operating an 75-year-old elderly lady who presented to me with a large swelling in the lower part of a tummy, that is abdomen. She was not able to walk, as she was almost telling, I have 2 abdomens, 2 tummies. I have proper abdomen, and then lower down I have another bag-like swelling which is hanging down while she walks. So it was so difficult for her to even walk. And this lady also had incidentally symptomatic gallbladder stones, so which we have dealt with laparoscopy, and the lower abdominal large incisional hernia was dealt by open surgery. So on exploring the lower abdomen, there was a large hernial sac which was containing almost all the small and large intestinal contents as sac contents in the hernia. We have done a proper incisional hernioplasty by putting a large mesh, almost like an armory. It was a 30 by 30 mesh which was placed, and patient she was made walk on the second postoperative day, which she was so happy and to walk, even though she was such an elderly lady. She was happy to walk because that large swelling which was there giving her a lot of discomfort was tackled. And the second day she started walking, and she was discharged on 3rd postoperative day, and she was doing absolutely fine postoperatively. It is basically all these years she suffered thinking that the surgery is not possible in her because of the size of the swelling. Few surgeons she consulted before she coming to me. They advised her that this is a large swelling, the defect closure is not possible in view of her age. We may not be able to put the mesh because of the large defect size. But we explored the abdomen and tackled a large multiloculated hernia sac, after removing which there was a defect of around 8 by 10 centimeters. After dissecting all the layers, we were able to close the abdomen and repair with a large possible mesh, that is the 30 by 30 size is the biggest mesh available in the market. With that, we were able to nicely do a hernioplasty, and the patient was so happy and she was doing absolutely fine post-operatively. On review, on the 10th day of the 10th post-operative day, I was a bit doubtful that she may develop some wound abscess, because as at the lower abdomen and the flaps were raised, and maybe she will have a compromised skin flaps, but she was doing absolutely fine. All the sutures removed and she is doing absolutely fine. This is one of those cases of giant incisional hernia which I have operated. Maybe once in 2 or 3 months we get such a huge incisional hernia. Most of the patients, they themselves postpone, thinking that this is not possible, and few patients with the medical advice that better you carry on, as in view of your age, better you carry on with the swelling instead of getting the surgery done and getting the complications. But here with us in our institute, Yashoda Hospital, Malakpet, our team, we have done very good number of incisional hernioplasty, giant incisional hernias. We have a series of more than 100 cases where we have hardly seen any complication, except a few wound gapings, maybe a centimeter or two, and which will heal with a patient cleaning of the wounds regularly and care of the wound. So they do absolutely fine, and they repent. They say, sir, all these days we have been suffering with such as large swellings. We are lucky to come to your institute and get the operation done. And one of my relative is there who is having similar swelling. Likewise, the patients themselves refer the patients, and we operate here, and they do absolutely fine. And there are challenges in the surgical field. We love to take challenges and give good results. Thank you.